Are you suffering from those muscles that's aches and pains? Let me tell you the difference between a prenatal massage and a traditional. Come on board. I have information for you. Hi, my name is Karen, the prenatal massage therapist at Healthy Bump Club. I am here today to give you all the information you need about the difference between a prenatal massage and a traditional massage. So, the difference between those two are the prenatal massage, you will have two different positions. When you go to any clinic or spa or any facility, they will have you laying on your back with comfortable pillows up under your back and up under your legs. However, they do have some customized tables that has an opening for your belly to be in, but that's rarely you will see a clinic will have that. However, they will have a regular massage table for you to do a sideline position. A sideline position, you will be laying on your left or your right side. Some massage therapists allow you to stay on one side and you do everything there, but some of them will like to get the full effect of it. So they will have you laying on your left side and then take the pillows from under you and have you turn over to your right side. It's very comfortable and very easy to do, and it will not harm you or the baby. So we would definitely have pillows up under your head, around the baby, having that comfort by that belly that you have, and having those pillows between those legs. We'd like you to be more comfortable than anything else. Now, a traditional massage, you would be laying straight on your stomach for majority of the time. And then we will have you to turn over onto your back, and then we continue out the massage. So a typical day that you would normally have when you come into a place or a facility, to get a massage, the front desk would typically ask you certain questions like how far along are you? And I know a lot of people in the front desk will have to know this information. When you tell them the weeks, sometimes people are wondering, what is weeks? What is the trimester whole situation is and everything. Even me, I didn't have 3 kids, and sometimes I'm like, okay, you tell me the weeks. I know how far along are you from first trimester, second to third. Now, when you're in your first trimester, it's from conceiving to 12 weeks. When you're in your second trimester, you're in your 12 to 24 weeks. And when you're in your third trimester, that's 24 weeks all the way up to 40. Now, that is how we determine what trimester you're in from first, second to third. Now, typically, a lot of facilities do not like to do a massage in your first trimester. They consider it as, if they said it's an increase of high risk and miscarriage. But however, if you find that right massage therapist that's been doing it for years, like me, we have no problem of touching you from your first trimester to your last. Well, you have to have somebody that's very specialized in that to want to take care of a prenatal massage, because there's certain techniques that you have to do, and it's in certain areas that you should not trigger and touch on. Now, let me tell you, once they put all their notes in, have asking you how far along are you, what trimester you in. You will also be asked, do you have any medical complications? And if you do, we will have to have an excuse from the doctor to say it's okay for you to get a massage. If not, and everything's good, then you are free to continue your massage with the therapist. Now, the therapist will get your notes. Sometimes the front desk will put the notes in, and sometimes they won't. So when your therapist come and pick you up, they will call you by your name, of course, and ask you a few questions, just reiterating and going over on what the front desk have done. And if you need to ask more, or we need to get more information from you from the stuff that the front desk did not get, then we will ask more. So we will ask typical questions again. How far along are you? Do you have any medical issues? And how are you feeling? Is this your first pregnancy, your second, or whatever? How's your body feeling? And most importantly, everybody comes for those aches and pains that you have. So we want to know what is bothering you, what is your aches and pain. If you can find a prenatal massage therapist that asks you what is your aches and pain, you found a winner because she is concerned about you. She is wondering about you, particularly on how you're feeling and everything. Now, a lot of people get the mid back, lower back, and the hip areas due to when you're in the second trimester and third because of the baby weight. The baby is expanding, especially if you're a first time mom. The baby expanding your body more and more if you was a smaller, uh, a petite person. And even if you wasn't, your baby is still spreading out your hips and thighs and everything. So your body is trying to learn how to adjust and how to go through this way of living now. And at that, you will have the aches and pains. Now, it's great techniques that we could do to get out those aches and pains without hurting you or your lovely baby. Okay. So, with that being said, we would get you in there. I particularly like to start off when I have a mommy in there that's in her first or second trimester. Let's see how comfortable she is to do sideline from left to right. We are there to relax your body and your muscles and stuff. So when you are able to, your body is prepared and ready to give birth. So it is a lot of things that your body goes through, but prenatal massage is there to help. The benefits of that is releasing stress that you will have, especially if you're a working mommy, or you could be a mommy at home, but you have one or two other children at home too. And you're a stay at home mommy. You still need some time alone. You still need to get that stress relief out. You do not want to be stressed by having this baby. That is not good and it do cause complications. So therefore, we would like to relax you, relax your body at all times. Now, there is a couple of things that your therapist should know not to touch with a strong pressure, I say. We can still touch these areas, but do not touch them with a strong pressure. Those areas would be